We'll start, ma'am.
Yeah.
Namaste to everyone. A warm welcome to our guest lecturer, Dr. Manavalan sir, Principal Ramanavan sir, Headmistress Srimati Meenakshi ma'am, Coordinator Ashwin sir, teachers, parents, and students. Today, our topic is career opportunities in Indian medicine, that is AYUSH. What exactly is the meaning of AYUSH? In Sanskrit, it means long life. Normally, we actually wish Ayushman Bhava. In Indian traditional medical field, AYUSH is an acronym. The expansion of it is Ayurveda, Yoga and Naturopathy, Unani, Siddha, and Homeopathy. What a fantastic coincidence, isn't it? An acronym is actually satisfying the purpose of the institution. So with the increase in awareness and for natural healing, the demand for traditional medicine practice has been on the rise in India. So keeping that in mind, D.A.V has organized this career counseling session, which will throw a great light into this field. Before entering into the program, I now invite Shri Pathasari sir to render a prayer song. Please, sir.
Namaste. I have taken a verse from Thai Manava's devotional songs.
Manavalan sir, you can come on video, sir.
ஞானமே வடிவாய் தேடுவார் தேடும் நாட்டமே நாட்டத்துள் நிறைந்த வானமே எனக்கு வந்து வந்தோங்கும் மார்க்கமே மருளர்த்தம் அறியா முதலே முத்தினல் வித்தே முடிவிலா இன்பமே செய்யும் தானமே தவமே நின்னை நான் நினைந்தேன் தமியனேந்தனை மறப்பதற்கே தமியனேந்தனை மறப்பதற்கே. Thank you.
Mute, unmute, Bindu. Bindu, you should unmute, Bindu.
Not, I think I
Yeah.
okay.
Yeah, now it's fine.
Okay. Thank you very much, sir. I now invite our headmistress, Srimati Meenakshi ma'am, to introduce a speaker.
Namaste to one and all present here. The speaker of today's evening is Dr. N. Manavalan. He'll be dealing with the topic career opportunities in Indian medicine, AYUSH. I'll just introduce the speaker to you. He's one of the most eminent personalities that we have for this evening. Dr. Manavalan is presently serving as the principal of Government Yoga and Naturopathy Medical College and Aringer Anna Government Hospital of Indian Medicine Campus, Chennai. He's been the Joint Director, Commissionerate of Indian Medicine and Homeopathy. He has 30 years of clinical experience in treating different kinds of diseases through naturopathy and yoga system of medicine. He has participated in various international events and presented papers on recent developments in naturopathy and yoga. He has involved himself in organizing Arogya Fair 2010 at Chennai Trade Center from 27/5/2010 to 30/5/2010 as a coordinator for the entire program. He has conducted special sessions on stress management for IAS officers through yoga and naturopathy. Namaste and a very, very warm welcome to you, sir. I think you will be one of the most befitting personalities to address our students on career guidance program, because we keep hearing a lot about NEET and the failure, the NEET, people who accomplish NEET and people who do not go through the exam, and it becomes a cause for dejection that they are unable to take up that field of study, and their dreams are not fulfilled. but here's a wonderful opportunity in Indian medicine, and sir will be giving you an insight into the process of the courses available in this field, how you can get into it, if there is an entrance examination for you. I mean, sir will be dealing with all these things. And so children, yeah, it will definitely be a very enlightening session for you, and have a discerning eye and ear to the program, to the webinar. Namaste and thank you so much, sir. From here on, you can take on, sir.
Yeah. Good evening. Namaste to all, dear students and D.A.V family and teachers. It's a good opportunity to exchange our knowledge to upcoming doctors in this Indian system of medicine. See, basically, after 10+2, the students, they think about medical line, the medical system of medicine, and to become doctors, to serve the community. See, the concept is to become a doctor. Of course, it's a very noble profession, and best opportunity to provide public health service to the people, and best healthcare service to the family and community. See, many people may not aware there is availability of career opportunity in Indian system of medicine. There is a Ministry of AYUSH. Now they renamed as a Ministry of AYUSH. As you know, you might have heard, the AYUSH stands for, as our earlier teacher explained about, what do you mean by AYUSH? See, it is a system of medicine comprised of basically 5 systems of medicine, Indian system of medicine. Of course, now very recently they have included one more system of medicine. That is a very recent thing, Tibetan medicine. That is Saurigba. It is only Himalayan belt. It is available. Otherwise, commonly in India, we talk about 6 systems of medicine. Recognized 6 systems of medicine. That is, first is that allopathy. That is a MBBS, Bachelor of Medicine and Bachelor of Surgery. It is a 5.5 years course. Apart from allopathy, as recognized system of medicine, you have other 5 systems, and that is AYUSH. So, like Ayurveda, homeopathy, Unani, Siddha, and yoga and naturopathy, and latest included like Saurigba. See here. See, as a student, see, commonly they well aware of certain courses. Say, as a parent, I am also a parent for 2 sons, and they are we are from D.A.V family, where they have spent their whole life of 14 years, from starting from LKG to +2. Both the sons have studied from D.A.V. So when they completed the +2, so every parent will have their eager to guide the children to study what is their future. So whether they want to go for engineering or whether they want to go for medical. So this is a common, I'm talking about very common, people psychology, that either they go for medicine, they think about medicine, or they think about engineering, apart from all other courses. So when they come for the medicine course, medical course, as a young, energetic, budding students, they need some guidance, because they may not aware, they may not know the entire courses available in this globe. It's not possible. So as a teacher, as a mentor, as a parent, as a guide, they definitely need to guide the students if they have some interest on that line. See, ultimately, students go to their study either based on their own interest or based on guidance, which is available through so many resources. But today, this occasion where I had opportunity to explain about what are the courses are available in medical, that to Indian system of medicine. Because modern medicine, so-called modern medicine, is MBBS. That most of the people know about it. They are well aware of that also. But other side of medical system, where one can become a doctor, one can become a practitioner, registered medical practitioner, and they can practice their medicine and they can serve the community. They can have their own set of clinic, all those things. So if that way, if the candidate is interested, if the student is really interested to study this Indian system of medicine, exactly alternative system of medicine, the word which I want to tell you, because the alternative medicine which is used in India, but in India, this is the mainstream medicine it could be. We are alternative to Western medicine, and Western medicine is alternative to Indian medicine. So it is all, where it stands like that. So apart from this Indian system of medicine, how it is effective in their personality, their personal life, their family life, their career. See, career is one main object, no doubt. Career is a main one object. Apart from that, there are certain things which we also look into: our own health, our family health, society health, and service sector. There are good number of people who want to do really service in their life, like health services. So all those interested candidates, the students who have studied 10 plus 2. See, basic qualification is 10 plus 2. That is physics, chemistry, biology students. So that is the basic education. Now, let us go to our slide. Say, for example, there are medical courses under AYUSH. See, AYUSH is the real meaning of AYUSH is life. But the Ministry of AYUSH, the Government of India, Ministry of AYUSH have developed such a excellent department where they go with education, they go with clinical services, they go with research, they go with the community reach, they go with medical tourism, all those areas. So today we are going to look into who can study this course. After studying this course, what they can become, what will be their future, how they can enjoy their life. See, after all, human evolution is they should have peaceful life, healthy life, and monetary also, and self-dependability. And they should be entrepreneurship rather than working under somebody. They can make their own entrepreneurship where they can provide job opportunities for the people who need. So that way, if you look into this, there are mainly, I'm going to talk about the 5 systems of medicine. The first system of medicine in AYUSH, for example, BNYS. BNYS is a Bachelor of Naturopathy and Yogic Sciences. It is concerned with yoga and naturopathy system of medicine. Second is BAMS. BAMS is a Bachelor of Ayurvedic Medicine and Surgery, where it's related to Ayurveda. Then BSMS. BSMS is a Bachelor of Siddha Medicine and Surgery, where it related to Siddha Medicine. And BUMS, Bachelor of Unani Medicine and Surgery, where it is related to Unani Medicine. And BHMS, Bachelor of Homeopathic Medicine and Surgery, where it related to homeopathic medicine. So this all systems of medicine is entirely different stream. It is an independent system of medicine where the curriculum, the syllabus, the regulation, the scope, everything is totally different. Different in sense, individuality, identity. It's so they can practice only their particular system of medicine. Why I'm saying is, if you select a yoga naturopathy system of medicine, you will be called as a yoga naturopathy doctor. If you select Unani medicine, you will be called as a Unani doctor. Same way with other system of medicine also. So before you enter any system, this AYUSH system of medicine also, where a student can select which area he is most interested. Like you have in different branches. It is not a branch. It is a system of individual system of medicine, where individual system of medicine has got its own identity, its own clinical practices, its own research, its own post-graduation courses also in this sector. So now, what is the duration? After plus two, of course, you are studying for, 12 plus 2, 14 years. If you start from LKG, UKG and first standard to 12th standard. After that, you have to spend minimum 5.5 years duration. 5.5 years. Your life will be totally molded to that particular health sector, health services, where you have to undergo 5.5 years undergraduate course. This is only undergraduate. So in this undergraduate course, medical degree course, in this 5.5 years, 4.5 years you will be studying as a student. Then 1 year you have to go training as a junior doctor. As a junior doctor, that is internship. House surgeonship, they will say internship. It is called compulsory rotatory residential internship, CRRI. Compulsory rotatory residential internship of 365 days without even a 1 day break. 365 days, you are just given training in the hospital in different departments. Like every system has got its own 12 months program. So in that period, the junior doctor period, you will be called as a junior doctor, where you will be given temporary license to do that practice. Because every practice, you need license. Because that's why they say medical registration, medical license, where you are licensed to treat the patients. Because if you want to touch, you can touch your own body. You need not ask anybody. But you cannot touch others' health, others' health purview, others' body without the license. That's why they say it's a medical registration where you have to get. So 4.5 years intensive study, then 1 year house surgeonship, that is CRRI, where you will be rotated entire 12 months of period. In the 12 months of period, you will be posted in all departments, like your naturopathy department. If they study BNYS course, they will be posted naturopathy yoga related departments, emergency medicine, minor surgery, first aid, and all other obstetric gynecology, but to promote the natural delivery. And they will be also posted in community health. They'll be posted in different manipulative therapy, magnetotherapy, acupuncture, all those things. Suppose if you go for Ayurvedic medicine, same way Ayurvedic medicine for 1 year internship, they'll be posting in different departments. So that 365 days, you have 24 hours, you are exposed to training patients, and you will really enjoy that life of that 1 year where as a junior doctor, and you are paid internship. During internship, you are paid stipend. The stipend equivalent to MBBS doctors, like per month, maybe that per month they pay about 25,000 rupees per month. So for doing that training period. So to do this course, okay, now you know about system of medicine clearly. Which system you want to select, that is up to you. You can decide. There are, I said, about 5 systems of medicine. So I have explained about the duration. If you are able to spend 5.5 years of your life to become a doctor, okay, then you select the stream, the system of medicine. You have understood what is 5.5 years, okay. Now, who is eligible for that? So that eligibility criteria. See, for any admission, for example, government colleges, there are government medical colleges, there are private medical colleges. So admission criteria is same. Admission criteria is same, but based on the merit, you will be getting either in government colleges or in the private colleges. There is only option. So for entering to these courses, for applying to these courses, you are supposed to have basic eligibility. So what is that basic eligibility? So same like MBBS, here also, after completing 10+2, physics, chemistry, biology, or botany, zoology. So in this course, you should complete in single appearance, first appearance, then you have to appear for the NEET. So here also the national eligibility test for entering into these medical courses. for 4 courses, except yoga and naturopathy system of medicine. For all other course, the NEET appearance, the NEET score, the admission is based on NEET score. Okay. So, first of all, if you are physics, chemistry, biology student, if you want to become a doctor, if you want to be a medical professional, then the option is apart from MBBS, you have 5.5 years equal, same 5.5 years, you have that, all 5 courses. Earlier I explained about you. Out of that 5, yoga natural system of medicine does not need NEET. That is based only on +2 marks. +2 marks. That is in +2, physics, chemistry, biology will be taken together for 200. That means biology for 100, physics for 50, and chemistry for 50. So totally, it will be made as a 200. This out of 200, they will arrive the merit list. So you have to apply to the selection committee. Government of Tamil Nadu, I am talking about the state of Tamil Nadu. The government of Tamil Nadu normally calls for applications. So that applications, you have to apply. Application can be downloaded through online, but you cannot apply through online. It will be a physical form where you can apply based on your +2 physics, chemistry, biology marks. Here, no need of NEET. I want to be very, very clear. The NEET is required only for other 4 courses, except yoga and natural system of medicine. For yoga and natural system of medicine, you need not have any NEET score. You will not appear for the NEET. But that will be based on, the admission is based on your +2 marks, physics, chemistry, biology. It will be made into 200. In that 200, 50% is biology, 25% is physics, and 25% is chemistry. Okay. So this is the basic eligibility. So minimum mark, there are in prospectus, if you go through the prospectus, it will be very clear because I cannot explain the entire line by line, but it's also based on, community basis. Like OC, 50% is required, and MBC, 45%, BC, 40%, SC, 35%, like that. It will be decided by the selection committee, and they will, call for notification. Based on notification, you can apply, and you can see your rank. Based on the rank, they will call you for the counseling. So the counseling will be conducted in Chennai. Based on your merit, they will prepare the merit list based on the number of applications, maybe 3,000, 4,000 applications. Based on the applications, they will prepare the merit list. Based on the merit list, you will be called for the counseling, and counseling will be conducted for many days, maybe 5 days, 6 days, 7 days, 1 week time. So first day, they will be calling for first 500 rank. So like that. So when you come for the counseling, based on your mark, the availability colleges will be displayed in the notice board. So for example, you have government colleges. For example, I am talking about government colleges. There are private colleges. For each system, there are private medical colleges. But government colleges, for each system, we have government colleges. For example, you have for yoga naturopathy, you have government yoga naturopathy medical college, Arumbakam, Chennai, with annual intake of 60 students. Same way, International Institute of Yoga Naturopathy Medical Science in Chengalpattu, number of seats will be 100 annual intake. So same way, if you go through Ayurveda medicine, there is government Ayurveda Medical College located in Nagarkoil, Kanyakumari district, Nagarkoil, where you have 60 annual intake. Same way, government Siddha Medical College, you have Chennai, 60 seats, and government Siddha Medical College, Palayangkote, Tirunelveli district, about 100 seats, and government Homeopathy Medical College, Madurai district, near Tirumangalam. So you have 60 seats, and government Unani Medical College, Chennai, about 60 seats. So this is the present available, number of seats in government colleges for each system. And apart from this, we have more number of private medical colleges. For yoga and naturopathy, we have nearly about 19 medical colleges, yoga and naturopathy medical colleges in Tamil Nadu in various districts. So same way for Ayurveda, Siddha, homeopathy, and Unani. Unani, we don't have medical private medical college. For Unani medicine, we have only one government college. For all other systems, we have private self-financed medical colleges and government medical colleges. But the admission is purely based on merit-based. Apart from this, for Siddha, Ayurveda, Unani, homeopathy, there are, all India quota also. All India quota where you can apply for that. But that all details you have to watch in the Tamil Nadu Health Department website, where it will be notified, every time. So you can go through that. All details are available. Entire prospectus for government college, entire prospectus for the private college, the fee structure, the everything. All details are available, in the website. They will be notifying for the students to apply. Okay, so here thing is the students, the parents, where they should understand clearly about these courses and the medium of the learning also. Because here, for example, I'll tell you, yoga naturopathy is purely English medium. Homeopathy medicine is purely English medium. And Siddha medicine, bilingual. There is a Tamil and English, but they must know Tamil language. The Tamil language, without knowing Tamil language, they will not be able to study the Siddha medicine. Like that, Unani medicine, for example, Unani, they should know about the basic Urdu knowledge, because that most of the texts will be available in Urdu. So they need to study Urdu. They need to study the Urdu basic test before the starting that course of study. So like that, there is a little difference between each system of medicine for eligibility. That is a special eligibility, where they can the students can understand by going through the detailed prospectus. Okay. So,
sir, on behalf of the students, I will ask you a question, sir, which might even help the students.
Yes, ma'am.
In how was the curriculum, sir, in all these things? Is it very different from the allopathy one, or they touch? About we here also we study about something very similar to allopathy.
Yeah. See, basically, this I told you, the 4.5 years course of study. All these colleges are affiliated to the Tamil Nadu Dr. MGR Medical University. So the degree awarded by MGR Medical University, all the examinations are conducted by MGR Medical University, and rules and regulations are framed by the MGR Medical University, and syllabus also. The syllabus are available for each course. The syllabus and regulation curriculum is available in Tamil Nadu Dr. MGR Medical University website. So, I'll just give brief. For example, if you say yoga naturopathy system of medicine, first year, the first BNYS. I'm just saying, for example, first BNYS is 18 months. Second BNYS 12 months. Third BNYS 12 months. Fourth BNYS 12 months. So totally 4.5 years. 18 months, 12 months, 12 months, 12 months, totally 4.5 years. In first 18 months, they have to undergo very rigorously about basic medical science subjects, same like MBBS, all the subjects they have to undergo. For example, anatomy, physiology, biochemistry. Apart from this anatomy, physiology, biochemistry, they also have to undergo philosophy and practice of yoga. Philosophy practice of yoga and philosophy of nature cure. So this 18 months, they have to read purely English medium only. So same subject, same syllabus, same textbook. There is no difference. For anatomy, physiology, because human body cannot differ from system to system. So every system, human body is one. Patient is one. Only the treatment may differ, but the basic science is same. So they have to undergo, they have to study. And for second year, for example, second year, for 12 months, they have to study pathology. Pathology means knowing the diseases, study of diseases, and microbiology, the study of microgerms, bacteria, virus, fungus, all those parasites. The basic pharmacology, and they study about all other naturopathy subjects, psychology, basic psychiatry, like that. Then philosophy and practice of yoga, and yoga and physical culture subjects, and they study some other natural cure also subjects. Like third year, for example, when you come to third year, sorry, not third year, third BNYS, because first is 18 months. So in third BNYS, they have to study community medicine, same like MBBS, and they have to study obstetric gynecology, the same subject, same textbook, and they have to study massage therapy, they have to study all other magnetotherapy, chromotherapy, and nutrition and herbology. See, why I want to emphasize this, the only medical course doctors study about nutrition is only BNYS doctors. Because normally, for other things, they have nutrition, BSc, MSc, and clinical nutrition, all those different courses are there. But in medical course, where disease oriented, where, for example, if you ask a doctor, sir, madam, sir, can you tell me about the diabetic diet? What diabetes patients should eat, what they should not eat, what therapy you give, diet therapy. So that is possible by yoga and naturopathy doctors, where they study about nutrition and herbology in third year. So they also study about herbs. See, today, present life, our lifestyle, the entire globe, entire continental, all continentals are looking into this sector now, this nutrition, this herbology, natural medicine without any adulteration as a natural source. For example, you say, okay, curry leaf juice, or cabbage juice, or herbal juice, or coriander juice, something like herbal juice. So they study medical concept, they study indications, they study contraindications, they study about the alkaloid, what it contains, they study about antioxidants, they study about micro elements, that is called nutraceuticals. They nutraceuticals, like you might have heard about pharmaceuticals, but we study about nutraceuticals. Even though we study basic pharmacology subject, the entire pharmacology is studied by our doctors. You know why? Because when patient comes to us, they bring lot of medicines. Because patients directly, they don't come. After 10 years, after 5 years, after seeing many doctors, at last resort also, some patients will come into this system, because they think that let us try for this. So that time, a doctor must understand what medicine he is taking, what medicine he can reduce, what medicine he can stop. So that's why the basic pharmacology also being taught to the doctors. In third year, like obstetric gynecology, to promote natural childbirth, gynec problem. Then also they study about massage therapy, acupuncture also. Then final year, they study about emergency medicine, minor surgery, first aid, all allopathic subjects. Entire, they are posted into the allopathic medical colleges. They are training for all emergency, and all other subjects like acupuncture, acupressure, reflexology, Reiki, and yoga therapy. Many people understand yoga, because now today yoga has become worldwide. It has reached every home. But here, yoga doctors, because yoga is excellent medicine. For many diseases, yoga can be given as a therapy treatment, but they're more suitable yoga doctors. 5.5 years, they study about that. So this, apart from modern subjects, all modern subjects are being taught. And you know that our doctors, they'll be able to diagnose. See, diagnosis disease is very important, as madam was asking. Are they studying about their subject? Yes. That all, blood test, X-ray, ECG, modern diagnostic methods. They have separate paper like modern diagnostic methods. And they have their own diagnostic methods. For example, pulse diagnosis. By seeing their pulse, they could be able to diagnose. Color diagnosis, chromo diagnosis. And they have other method of diagnosis, iris. Today, Google has, I just out of interest, I'm telling you, the latest research, the latest study shows by looking at your iris, they can able to diagnose your heart disease. This is what now latest Google is trying to bring out. That's what I have gone through the paper. But this is being studied for 300 years. The text is available long back 300 years before they have documented. Now our doctors are able to diagnose by seeing the iris. They could able to diagnose what internal disease, what is internal organs are damaged. For example, heart, liver, spleen, uterus. A lady has come for diagnosis purpose. Our doctor examined. After seeing the iris diagnosis, our doctor said, "Madam, when did you remove your uterus?" She was shocked, really. Hey, what? How do you know that? What doctor, how do you say? No, your uterus is not appearing here. That means it's removed. Hysterectomy was done. So such a way, it is a science. It is an evidence-based science. Evidence-based science. Only thing is, it is a developing. It is developing. Now younger generation has come up and they are putting into research, clinical trial, clinical research, they are publication of that. So they are studying modern subjects, modern medicine along with this, their own individual system of medicine. So they can understand easily, they can understand the patient, they can diagnose and they can treat. The treatment differs. The treatment system to system differs because each system of medicine has their own treatment methodology. That is the only specialty. That's why there's more than 1,000 years, more than 10,000 years, the system is surviving even now because it has its own uniqueness. It has its own specialty, its own benefits, and its own followers. Even there are people, they say, "Doctor, I don't want to take drug. Please tell me drugless medicine, natural medicine." There are so many followers. There are so many patients in our hospital. If you just, I want to, this is the only small message I want to give for younger generation. Parents, if any parents or teachers, please visit, Yoga Naturopathy Medical College Hospital, where every day 500 patients and IP inpatients, 0 rupee cost. Not even single rupee you have spent, but there is a 5-star treatments, good facilities, where you can health services are being provided by our younger doctors, our qualified doctors. So this is a one small example I'm telling you. So like that, the whole Tamil Nadu, the health services are extended with all this system of medicine, the Indian system of medicine like AYUSH sector is being provided in public health services. Now, that's why now it's becoming popular and people are turning towards this natural, medicine. That's what I can say. It is a lifestyle medicine rather than, lifestyle medicine. See, today, of course, we are repaying. We are repaying the cost where we have done our last 50 years of our lifestyle is changed now. We are away from nature. We are following not natural law. And because of that, we are repaying with the diseases. We are repaying with our own cost. There are patients who eat a lot of medicines. They spend a lot of money towards cost where they need to sell their whatever it is, property. Even they are selling property, they are going for the treatment cost. But this is AYUSH system of medicine is a low cost, sometimes no cost, low cost, sometimes no cost, where individual can easily follow the technique. And the medicines are natural medicines are available around our area. We need not search for, we need not travel for long. No, everything, most of the medicines are available within our reachability, accessibility. Only thing is we should know, we should have the knowledge. So for that sake only all these courses, all this research studies are going on, and we are promoting, we are trying to educate younger generation. This is also good opportunity. When Madam Headmaster was contacting, and she was very much, trying to catch me. In fact, catch me and, putting to this to make aware. I must say thanks to the D.A.V family, where this is awareness which we are telling the students, engage students. If at all any students interested, at least they can enter this, line, because even could you imagine that in 1982, almost now 38 years. Could you imagine that when I entered to this field in Osmania University, Hyderabad, there was no college in Asia. There was not even a single college in Asia about 35 years back, 38 years back. I could able to venture this course, and today we are able to be in limelight. Today we are the leaders in this field. We are educating, we are doing guiding, and we are encouraging these people, public, and of course we have full satisfaction where we are able to provide good health services to the public with low cost and sometimes no cost, and where the people enjoy with the health, they are able to come back. So, okay, now the main important area. As a student, I know, as a parent, finally I end up with what, after doing this course, what will be my children, how much they earn, what is their lifestyle, what will they get job opportunities. சிம்பிளா படிச்சுட்டு வேலை கிடைக்குமா கிடைக்காதா, அவங்க சம்பாதிப்பாங்களா சம்பாதிக்க மாட்டாங்களா, அவங்க லைஃப், whether they take their life self dependability or self reliance or whatever you call it. So today is a materialistic world. People are measured only with their wellness, not health wellness, their like package. So after course study, what is that package? Of course, I even though I am not related to that, but still, this is the many people's psychology, many people's expectations. So definitely today is very attractive field, very attractive field compared to any field. I can say it's not because I am doctor, I am AYUSH, I am telling you, no. Today, the present life, when you complete your 5.5 years course, you are more opportunities to get best employment and best clinical practices. And if you want to earn money, it's not at all difficult. Either you want to earn money for 50,000 rupees or 50 lakhs, it doesn't matter. It is a capacity, knowledge. If you gain properly, if you are committed to your field, there is no limit. So easily they can get their job. The job opportunities are lot, because they are multi-skilled people. For example, after 5.5 years, they have to medical registration. They have to do, first thing is, after completing their study, they have to get permanent medical registration as a registered medical practitioner. They will be given licensing number. Once you get that number, their license, you can start work. What way? If you don't want to work under anybody, yes, definitely you can stand on your own practice. So you can start your clinic, you can start your hospital, even big level hospital, depends on your backup also. Basically, small clinic can be started with low investment. It doesn't need lakhs of rupees. No, you should need to have 10 by 10 a small room where you can put a table, chair. You can start your clinical practices by just doing a consultation, by just doing your simple treatment procedures. Even acupuncture today, madam, because today the acupuncture has become so popular. Every nook and corner, some fellows are putting a board, acupuncture clinic. And you know what is their earning? People are standing in the queue, token system. But of course, acupuncture is a recognized treatment in this BNYS course. The only medical course, degree course, doctor is recognized as BNYS course. The acupuncture, reflexology, all these subjects are included in the BNYS medical degree course, where they can start acupuncture. It doesn't need much technology, no. Simple. Easily you can earn per day 5,000 or 10,000, whatever you need. So what I'm saying is, I'm telling you a simple example. That's all, nothing else. So clinic you can start. You can start your hospital. Okay, you don't have that much. So it depends on individual also. So you want to work. Okay, then you can go as a government medical officers. Government medical officers in entry level post, assistant medical officer post. Assistant medical officer is equivalent to assistant surgeon. The same pay. MBBS doctors or AYUSH doctors or equivalent salary, equivalent pay. So their job is they look into allopathy practices and they look into the AYUSH practices. AYUSH doctor, they do AYUSH practices in our government hospitals. They will be appointed in primary health center. They may be appointed in district hospitals or medical college hospitals. Now we have entire Tamil Nadu. Almost we have all the hospitals. You can see AYUSH doctors, and you can see yoga and natural doctor in lifestyle clinics, medical college hospitals, allopathy medical college hospitals. If you go anywhere in Tamil Nadu, any medical college, for Madras Medical College or Skill Park Medical College or Stanley Medical College, Omandurar Medical College, or Multi Super Specialty Hospital or Madurai Medical College, then anywhere you go, there you can find a yoga natural lifestyle clinic, where a BNOS doctor will be sitting and seeing the patients. There is very good response now. So like that government service, you can enter. But of course, that is also based on exam, Public Service Commission exam. See, it's a merit. So always a merit student always stands on merit. His life will be so settled from the beginning to end. No doubt. Merit always speaks. So you have government services. Then, okay, you don't like clinic, you don't like hospital, okay, you don't like government service, you want to be a best teacher, you want to be a best faculty. Yes, there is a very good opportunity for teaching profession. There are n number of medical colleges, government colleges, and also private medical colleges, like professor, principal, assistant professor, associate professor, lecturer, so tutor, different categories. There are a number of posts are available. So you can join as a teaching faculties. Okay, you don't want to do anything. You want to study. You want to be a student. Furthermore, yes, furthermore also you can study. You can do your post-graduation.
Sir, by mistake, you've muted, sir.
Yeah.
Yeah.
And postgraduate is postgraduate is 3 years. So totally 8.5 years. So post-graduation courses like MD, you have Doctor of Medicine in different systems of medicine where you can study. And in naturopathy, yoga natural system of medicine, you have 3 specialties like MD in naturopathy, MD in yoga, and MD in acupuncture. Acupuncture in the world, first time. Government of Tamil Nadu has a master degree, the Doctor of Medicine in acupuncture and energy medicine. All these courses are affiliated to Tamil Nadu Dr. MGR Medical University, and they provide the degree will be awarded after completing their course. Okay, after 3 years post-graduation, you can join for PhD. As you know, it's a research-oriented, research scholars. There are research, n number of opportunities. There are people who want to do some study, some research. It's a new emerging field. What I could able to understand is the Western countries, they are doing a lot of research on this traditional medicines, AYUSH, natural medicine, and they are coming out with a good result. And we are also doing a lot of research. We have produced a lot of papers now, international journals, index journals, PubMed, medical journals. We could able to publish the research papers. So the research scholar, they can join as a research scholar. They can pursue PhD for another 3 years to 5 years like. So then they can have their own whatever they like. And entrepreneurship, like wellness centers, you have n number of wellness centers. Today, fitness centers, all they are hiring the best doctors. They are hiring the consultant. And spa today, the health spa worldwide, all entire countries, entire world, they are hiring the doctors. Now, for example, UK, Canada, US, our system of medicine is recognized. Most of the states is recognized, and the people are going to practice there. Like, Virgin Island, for example, I'm telling you, the BNYs, our doctors, even the island, small island, they are setting up these health and wellness centers, and they are able to provide good health services, and people are very much accepting it. So there is also job opportunities. And entrepreneurship, they can start their own industry, manufacturing industry. Like I said, pharmaceuticals, nutraceuticals, herbal industry. Today, herbal export is growing very fast. So we can export a lot of herbal medicines, natural medicines, nutraceutical components. And of course, finally, the research, where they can do a lot of research. And so this all very good opportunity. Only thing is awareness, knowledge has not reached sufficiently. So through this type of discussion, this type of webinar, this type of encouragement to the students. So like DAV family, like arrangement of students' welfare. Really, I'm very happy, madam, because see, at least the parents will understand what opportunity is available to become a doctor. If not MBBS, what is other alternative doctors where they can pursue, they can enjoy their family, they enjoy their health. And the most benefit is for their own health, their family health, the society health, they can definitely enjoy their whole life. So I think, I could able to give ample of, knowledge. So further knowledge, yes, each and every student can go through the website. Each college, they have website. They can go through their, website, and they can understand. And any doubt, they can contact the selection committee, or they can come over the Anna Hospital campus. So we could able to help them, no issue. We can guide them. And definitely future doctors, young and energetic doctors, they can come up, and they are blessed children. Definitely they are blessed.
Thank you. Yes, sir. Yes, sir. Thank you. Thank
Yes,
you
sir.
so
Yes, sir.
much,
Thank
sir.
you.
Such an enlightening session. Yes.
Yes.
Yeah. Bindu, you can take over.
Yes, sir. Yeah, the session was really very inspiring and informative. And it's really amazing to know that the worldwide recognition is there for this particular stream. Thank you very much, sir. I now invite
Thank you, madam.
Principal Sri Ramanavallavan sir to propose the vote of thanks.
Namaste. Namaste, Dr. Manavalan sir. Namaste. I'm sorry,
Namaste.
I joined a bit
Namaste.
late. I'm sorry for that. Namaste, HM ma'am. Namaste,
Namaste.
teachers.
Namaste, sir.
Namaste, my dear children. Namaste, one and all.
Namaste.
Good evening to everybody. Actually, India, our country, is treasure house of medicinal plants. It is a treasure house of medicinal plants. But actually, we are extracting the medicine, biomedicine. 90% of medicines we are extracting from those plants which are not cultivated. It is still, it's growing by themselves. Somewhere else in the remote areas, only the tribal peoples are knowing about it. So as Sarah mentioned at one occasion, a lot of scope is there for the children to do the research work. And they have to go probe, look and a corner everywhere in India. If they go, they'll find out the medicinal plant, and then they can extract the medicinal juice. And that can be very important nowadays, because there is no side effect at all. All these biomedicines have no side effect. And it's Indian practices. As Sarah said, there are about 5 different types of bachelor courses. One is about naturopathy, Ayurvedic, Siddha, Unani, homeopathic, etc. But all these things covers mostly documented. They are all documented by eminent people. For example, Siddha is documented by Siddhas. There are about 18 Siddhas I came to know. Am I correct, sir?
Yes.
Yes. And then when you see about the Charaka, Sashruta, Bhakpada, those kind of eminent people, they contributed Ayurvedic and folk system of medicine. It's a vast scope. In fact, when you compare with allopathic, this kind of traditional system of medicine available plenty for our children. And it's the right way we have with us Dr. Manavalan, the principal, government Yoga and Naturopathy Medical College and hospitals. Sir, on behalf of our management, staff, student, I'm glad to express word of thanks. A special thanks to yourself because you have spent your quality time with us amidst your hectic schedule. You have accepted our invitations and you have guided our students. Definitely, this is the limelight for our children to choose their future courses. Not only going into the allopathic, they can come to this kind of naturopathy. They can come to the traditional system of medicine. As you said, there is no differences at all. They are going to know about the health of human being, and they're going to study about the functions of our system and any problems, how to heal it, how to treat it. So more or less same, both in allopathic and the naturopathic, but some kind of interest from the younger generation or some other parent also, instead of sending to this kind of naturopathy system, they prefer to go allopathic, but slowly it has to be changed. I believe all this kind of webinar, like an eminent person like you, definitely will do some kind of changes, bring the children to learn more about the naturopathy. So once again, I thank you very much for your presence here and valuable guidance to our children. Thank you, my dear teachers and
Thank you, sir.
students,
Thank you.
Yeah.
and all the
Before-
members of
yeah.
the management, dignitaries. Thank you very much. Congratulations
Thank you,
to all
sir.
of you. Best of luck.
Thank
Before
you.
that,
Thank you, sir.
no,
Thank
one child has posted a question. How
Yes,
is my
sir.
cutoff calculated for admission? She scored physics 98, chemistry 97, and biology 95. As per what sir said, it is biology will be 50%, so it will be 42.5, and the other two will be 25% and
No,
each.
no, no, no,
Oh,
Ah.
neat,
no,
neat
not
is
like,
it.
not like that.
Ah,
See, 200 marks totally,
Yeah. yeah,
100 marks for biology,
100 for biology. Okay, yeah.
biology,
Hmm.
and 50 marks for physics,
Okay, yeah,
54.
50 marks for chemistry.
Chemistry.
yeah.
So,
So
for
in
example,
that case,
biology is, for example, biology 100 marks
hmm,
and physics 50 marks,
yeah,
chemistry 50 marks, so 200 total.
Hmm.
yeah.
Suppose a candidate has taken biology 80 marks,
Hmm.
so 80 plus chemistry, suppose he has secured 80 marks, means 40.
Yeah,
40 will be.
40,
80
yeah,
plus 40, 120,
yeah,
plus physics, if he has scored 80 marks, means 40. So
yeah,
120 plus 40, 160.
yeah.
So
160.
after
So,
200, 160
ah.
marks.
So that child, the child yours will be around 191.5 will be your
Yes.
your
Yes,
cutoff.
out of 200.
And out of 200. That's a very decent
Yes.
score. I think definitely you will be able to make it. Sir only must tell us, sir, 191.5, is it a good score, sir?
191 is a good marks, because our cutoff marks starting first rank will be around 196 out of
196.
200.
Oh,
196. Last year 196, 197. So
Oh.
from there starts, of course, it comes down based on their competition.
yeah.
Okay.
And there's one more student who's asked, can we specialize in gynecology in AYUSH?
Yeah. See, basically, after finishing this 5.5 years,
Hmm.
5.5 years of this undergraduate course, they can go for obstetric gynecology in their own system of medicine specialization.
Yeah.
See, every system has got their own specialization.
Yeah.
So, post-graduation in their women's disorder or obstetric gynecology, like that, they can go for that.
Yeah. Thank you so much, sir.
Thank you very much,
Sir,
sir.
very
Thank you.
nice, sir. Thank you so much.
Very nice, very
Thank
informative.
you, sir. Thank you, sir.
Rakesh.
Thank you, Dr. Manavalan, sir. Thank you very much. Thank you.
Thank you.
Thank you. Thank you.
Thank you, sir.